Have you ever pondered about the heartbeat, the rhythm of life that resides within us? This pulse, this life force is the domain of a particular breed of healthcare professional. Enter the cardiac nurse, a specialist in the realm of heart health. These nurses are the sentinels of the heartbeat, monitoring and caring for those with heart conditions. They ensure that this life-giving rhythm continues, unbroken, within the chests of their patients. A cardiac nurse, a heartbeat's best friend, is a vital lifeline in the healthcare industry. So what does it take to be this lifeline, this cardiac nurse? Well, it's a role that demands a blend of clinical expertise and compassionate care. As a cardiac nurse, you hold a pivotal role in the healthcare team. Your responsibilities are multifaceted and significant. You monitor the patient's condition, administer medications, and collaborate with doctors and other healthcare professionals to provide the best possible care. You'll find yourself at the front lines, working closely with patients who are navigating some of the most challenging times of their lives. You become their teacher, educating them about their conditions, treatment options, and lifestyle modifications. You're their advocate, ensuring that their concerns are heard and their needs are met. But perhaps the most vital role you play is that of a comforter. You provide emotional support to patients and their families, helping them cope with the stress and anxiety that often accompany cardiac conditions. It's a role that requires empathy, patience, and a deep understanding of the human spirit. Being a cardiac nurse is indeed challenging. The hours can be long, the work can be physically demanding, and the emotional toll can be high. But ask any cardiac nurse and they'll tell you, the rewards far outweigh the challenges. The satisfaction of seeing a patient's health improve, the gratitude in their eyes, the knowledge that you've made a difference in someone's life, these are the moments that make it all worthwhile. Being a cardiac nurse is not just a profession, it's a calling that requires dedication, knowledge, and a heart that cares. So, what have we learned today about the role of a cardiac nurse? In our journey through the heart of the matter, we've highlighted the crucial role cardiac nurses play in our healthcare system. They stand as the lifeline, providing specialized care to patients with heart conditions. From conducting stress tests to monitoring vital signs, these nurses do it all with precision and empathy. Their responsibilities don't just end at clinical tasks. They also play an instrumental role in patient education, helping individuals understand their conditions and the necessary lifestyle changes to manage them. To excel in this role, a cardiac nurse needs a blend of skills. Alongside a strong medical knowledge base, they must have exceptional communication skills, emotional resilience, and a keen eye for detail. In essence, being a cardiac nurse is about far more than medical procedures. It's about touching lives, making a difference, and ultimately caring for the human heart. Remember, a cardiac nurse does more than just monitor heartbeats. They touch lives, and perhaps that's the most beautiful rhythm of all.